Question 1. A hospice patient with metastatic esophageal cancer has intermittent bleeding from their tracheostomy site. The patient's wishes upon admission were to die at home. Current vital signs are BP 92/64 mm Hg, HR112/min, RR16/min, and temperature 97 degrees Fahrenheit 36.1 degrees Celsius. The patient appears anxious regarding the bleeding. Which of the following is the nurse's best response for evaluating the patient's goal of care? Option A. Initiate the patient's transfer to an inpatient hospice. Option B. Educate the patient about what happens during a hemorrhage. Option C. Obtain an order for an anti-anxiety medication. Option D. Ask the patient if they still want to remain at home. The correct answer is option D. Ask the patient if they still want to remain at home. Ask the patient if they still want to remain at home. This response is essential as it directly addresses the patient's previously stated wishes while also respecting their current emotional state and the seriousness of their condition. By evaluating the patient's goals of care, the nurse can ensure that care aligns with the patient's preferences regarding life decisions. A. Initiate the patient's transfer to an inpatient hospice. This option may not align with the patient's wishes to die at home, which they expressed upon admission. Transferring the patient to an inpatient hospice facility could cause unnecessary anxiety and go against their desire for home-based care, thereby not respecting their autonomy or previously stated goals. B. Educate the patient about what happens during a hemorrhage. While education is important, this choice may increase the patient's anxiety rather than alleviate it. Providing information about hemorrhage could overwhelm the patient at a time when they may be seeking reassurance about their situation, rather than a clinical explanation of the process. C. Obtain an order for an anti-anxiety medication. Although managing anxiety is important, this response does not address the core issue of the patient's current preferences regarding their care. Medications can help with immediate anxiety relief but do not facilitate a discussion about the patient's goals of care, which is crucial in this context. Conclusion. In life care, it is vital to align treatment and interventions with the patient's values and wishes. By asking the patient if they still wish to remain at home, the nurse can engage in a meaningful dialogue that respects the patient's autonomy and reassesses their goals of care in light of their current medical condition. This approach fosters trust and ensures that care is compassionate and patient-centered.